bladder cancer. So, talking about bladder cancer, the causes of the bladder cancer are tobacco, family history of the cancer, automobile exhaust, catheter irritation, bladder stones, and phenacetin. So, taking look at the this diagram, we'll have different types of cancers. That is cyst cancer, which is non-invasive flat high-grade cancer. Then comes TA, that is a papillary tumor without invading the bladder wall. Then comes T1, which is the tumor that invades connective tissue, and T2, which invades muscle layer after the connective tissue, and T3, where it penetrates the bladder wall, penetrating through connective tissue, muscle layer, and then bladder wall. Now, signs and symptoms for the bladder cancer is painless hematuria, that is blood in urea, painless hematuria, bladder bleeding, frequency, urgency, dysuria, that is painful urination, and weight loss and voiding. So weight loss is one of the common feature for any type of cancer. And now, how do we diagnose it? So we can diagnose it by cytoscopy with biopsy, and also we can go for bone scan and x-ray to look for metastasis. We can go for CT scan and MRI, and for complete blood count we can see anemia because of the bleeding. So to treat this cancer, the treatment options will be intravesicular chemotherapy, superficial tumor, that is, if there's superficial tumor, then intravesicular chemotherapy with mitomycin can be done with complete transurethral resection. So intravesicular chemotherapy is done when there's superficial tumor, and if the tumor is invasive, then we'll go with radical cystectomy and radiation. If it's metastatic, then chemotherapy. So, metastatic chemotherapy, invasive radical cystectomy and radiation, superficial transurethral resection, complete transurethral resection.